everybody, and welcome to Jeff's Guide to Acne Prone Skin. I know what you're thinking. Jeff's skin has always been perfect. That's not true. It hasn't. It's still not. So today I want to talk about drug options for acne prone skin. I'm not looking at like cosmetics or anything like that. Just what are the drug options, and kind of want to give you some pharmacy tips on how to reduce your out-of-pocket expense, because of all of the drugs where the pharma companies will gouge you on, skin and topical agents, it's just mind-boggling. I actually have customers come to the counter, and when they see the price of some of these products, they giggle. They think it's like, it's comical, it's so bad. For instance, like Epiduo Forte is like $600, and there's actually a way where you can get the main ingredients over the counter for Epiduo Forte. The strength's a little different or whatever, but it would basically be very similar to that, and you wouldn't be paying $600. You might be paying $20 or $30. So price doesn't always equal value. That's especially true with drugs. So I like to look at acne products or acne drugs kind of in a couple of different categories. So I think like the first line agent, these are like your, if you think of acne as a zombie, your first line agent is going to be like your bat or your Bowie knife. So these are drugs that are available over the counter, like Differin. Differin gel is actually over the counter now, and benzoyl peroxide. So benzoyl peroxide is in agents like Oxy, which is like the most potent one. It has 10% benzoyl peroxide. If your skin's more sensitive, just take the product. You know, it has a fancy picture on the front of it. Turn it around and look at what's in it. So benzoyl peroxide is a very strong over-the-counter acne agent. And if you have sensitive skin, you might not want to get the strongest, which is 10%. You could get 2.5% or 5%. And Differin is actually over-the-counter now, and this is kind of one of the newer over-the-counter products. It was always a prescription product. It's similar to a drug called tretinoin, which is a prescription-only product. Differin is an adapalene. It's a retinoid. It's related to vitamin A, and our tretinoin is similar to the Differin that's over the counter, and that's a retinoid. So using benzoyl peroxide or Differin gel on the skin, that's kind of your first line response to mild acne, just a couple pimples. Things like Differin, they're not supposed to be used as spot treatment. It's supposed to be just use a little bit all over the face. And before you add anything to using Differin or tretinoin, like if you wanted to add benzoyl peroxide, see how your skin reacts, because these agents can be very drying. Even benzoyl peroxide can be very drying. So try using one. With Differin, you might even want to use one. Use it once every other day, just to see how your skin reacts, and then you can go to once a day for Differin. And then if your skin's fine and it's not dry and you still have acne, you can also add benzoyl peroxide. And that would be more of a kind of an elevated response to the acne. Now, another product that is just a combination of two cheap drugs is benzyl. So benzyl is another very expensive drug. All it is benzoyl peroxide and clindamycin. You can get those, like your doctor could write a prescription for benzoyl peroxide and could write a prescription for clindamycin solution on the face. You could use them both, and you would save a lot of money than using benzyl, which is a combination product that's marked up. This is a common theme in pharmacy, where they take two cheap drugs, combine them together, and create a whole new expensive drug. So just so you know, you can just use benzoyl peroxide and clindamycin. So adding an antibiotic is kind of that second tier. These are more like your conventional weapons, like maybe like a pistol or a rifle or something like that is a stronger weapon against your acne. So clindamycin is an antibiotic is a topical antibiotic used for acne. It's often mixed with benzoyl peroxide, and sometimes your doctor might even prescribe an oral antibiotic to help with acne, and that's just another level of combativeness for the acne. So drugs like tretinoin, drugs like Differin, drugs like benzoyl peroxide, they can make your skin more sensitive to burning from the sun. So you might want to limit your sun exposure or get in the shade when you're out there at the beach or what have you, enjoying the summertime. So then the sort of the nuclear weapon for acne is isotretinoin or Accutane. It's sort of the oral tretinoin, which I discussed, there's a topical tretinoin, but you can actually take the drug by mouth. And since it's ingested in your body, there's obviously going to be more side effects, and it's actually more effective. So this would treat acne all over your body. Obviously skin dryness could be an issue, but it is considered the closest thing to a cure. In practice, I've seen really miraculous kind of transformations. People who had really disfiguring acne, kind of losing the acne. Sometimes they might have scarring as well, or they might not. It is something that has a risk mitigation strategy. It's a program to reduce birth defects because women that take it, if they get pregnant, their offspring would be prone to having birth defects. And so women that take it are required to have 2 forms of birth control. They're required to follow the iPledge program, and they have to get certified with the iPledge. Their doctor has to make an attestation that they counseled the patient on the risk of birth defects and that the patient knows about it. And so this is kind of a pain in the neck drug that we dispense in the pharmacy, because we have to go in like a website and write these numbers down and go through this whole process to dispense this drug, which is fine. But as a patient, you should know that it is something that is more of a serious medication than some of the other ones. And there are more side effects, obviously dry skin, chapped lips, even psychiatric issues, joint pain, sensitivity to light, and there's even, more side effects than that. Increased blood cholesterol and blood glucose. So it is a more serious drug. People do take it, and it can be taken, obviously, very safely, but it is something that requires a little bit more monitoring by the doctor and more counseling by the doctor as well. So those are kind of your options for acne-prone skin. You have your topical agents like benzoyl peroxide. Those are brands like Oxy. Probably Clearisil has a benzoyl peroxide, and Differin gel, which is a new class of medication for over the counter. So it's you could try Differin gel, and then if your skin can tolerate it, add benzoyl peroxide, and basically that is Epiduo. So why spend $600 when you can just, I'm trying to save you money. You don't need to get Epiduo. You can get benzoyl peroxide and Differin gel. It's very similar. The strength might be different, but you could just apply more. And then we have your topical your oral antibiotics, which is another level of attack to the acne, and then of course your Accutane type drugs, and that is the closest thing to a cure, but it is also a little bit more serious. So I hope you all found this useful. If you did, please give me a thumbs up. Please subscribe. It would be awesome to have you as a subscriber. If you already are a subscriber, thank you. It would be great to have you as a subscriber. My goal with this channel is to save people money, to educate people on drugs so that they can use them more safely, and that they can bring some of that information when they're talking to pharmacists and when they're talking to doctors, so they can be educated and ask better questions, and they can be kind of their own advocates in their own healthcare. So I hope you guys found this interesting. If you did, please give me a thumbs up and please subscribe. I want to thank you guys for watching. Thanks a lot.